Well, I see discount flea and tick meds on sites posted all the time, so can they be trusted? Dr. Kelley Gebhardt with Happy Tales Veterinary Emergency Clinic is with us to talk about that. There are just so many ads out there offering flea and tick meds for cheap. What should we be keeping in mind with that?
It's very important to remember to only buy veterinary products, whether it's oral or topical, only through your veterinarian, because there are two reasons. One, it's the only way you can guarantee the efficacy of the product or the realness of the product. So many of these products are counterfeit, and so you buy it, it doesn't work, you've wasted your money. But also, if your pet has a reaction to it, it won't be guaranteed by the company, right? If they say that it's from this company and it's a counterfeit product and your pet has a reaction, the company won't stand behind the product and cover the cost for treatment of the reaction. So there are many reasons why you only want to buy a veterinary product through a veterinarian to make sure you're getting a real product.
Okay, well, here's a question. This is one that my friend posed not too long ago. Do flea and tick meds have to be taken every month? Can't you just skip the winter months?
Oh, it's a good question. And you really need to, especially down here in the South, you need to give it every month because fleas and ticks are a problem all year long down here where it's warm. Heartworms, not as much in the very coldest months, but it's important to keep them on all year long to prevent to keep in the habit and also to protect your pets from fleas, ticks, and intestinal parasites during all year long down here. And heartworm, 10 out of the 12 months.
All right, somebody also said it's kind of like a birth control pill. It has to be taken at the same time every single month. Is that true?
Not exactly.
Okay.
It's good to get it on the same day every month, the 1st of the month, the 15th of the month, so you're in the habit of it. But there is a little bit of wiggle room. You could, if you're going to miss it, say you're going out of town and you know that you're going to be gone on the 1st of the month, it's better to give it early than to give it late, but just by a couple days. But if your pet, say, is having vomiting and diarrhea, if you can't give it on the 1st, you could give it on the 2nd or the 3rd or the 4th and be okay. You don't want to get outwards of a week, then you're running into potential risk of, yes, the infectious stage of heartworm disease could get into your pet even if they're on the medication. So there is this window of efficacy that is a little bit longer, there's a little bit of safety, but you don't want to stretch it out. So a couple days leeway is okay. You don't have to give it 8 a.m. on the 1st of every month to be effective.
Okay, all right. Now every pet owner dreads the thought of this right here. We're going to show you the picture of a tick being on their pet. So is this a thing where you need to like pat down the dog every single time they come in from the outside? And what do we do if you find a tick on your pet? It is very good to check your dog for ticks, especially if they go into areas with long grasses. Keep them on their monthly or every 3rd month topical or oral flea and tick preventative. If you find one, you want to, there are these little plastic tick removers with a little V shape in them that get right under the mouth part of the tick and then help you extract the tick without pinching and squeezing the tick. You don't want to squeeze the tick when you are extracting it because you're squeezing all those potential viral and bacterial infections in there. All that juice is going right into the pet and you don't want that. It increases the risk of disease transmission. So you want to try and get the whole tick, including the little straw type mouth called the proboscis. If the proboscis breaks off, it will eventually work itself out, kind of like a splinter, but it increases the risk of local infection and inflammation. So you want to try and get the whole thing, including the proboscis, and using one of the little V-shaped tick removers that help you extract it out is a good way to go. Okay, if we can't get the head out, like you said, do we need to then go to the vet or do we just wait for it to work itself out? You
can go to the vet when we have to use a little needle to kind of dig it out. That can also cause some infection and inflammation. You can also monitor it. It may work itself out without causing any inflammation or infection. So it's certainly individual situation. If you see redness and inflammation developing, have them checked out. If you're worried, have them checked out. Those are your options.
All right, so from fleas and ticks to the next thing, snakes, 'tis the season. Often the dogs are in the yard, right, by themselves. So how would you even know if your pet had a snake bite?
Most of the time they're going to come up to you either limping or like they just tell you they're not feeling good, something's different. You may or may not see puncture marks or bleeding marks on their muzzle or their paws, sometimes on their chest, depending on where the snake is when they encounter it. Most times dogs get bitten on the face or the nose because they're smelling it, and cats will get bitten on the paws because the cats are pawing at it. Sometimes you'll have vomiting, weakness, and collapse. Other times you might just see them limping and swelling at the site.
Okay, we've got about a minute left. If we see that our dog has gotten bitten by a snake, what do we do?
Seek veterinary care immediately. Do not put ice on it. Do not put a tourniquet around it if it's a leg. Do not try and do the cut and suck method. That is kind of one of those classic things. Just get to a veterinarian. If you have a small dog and you're hiking, pick the dog up so that and hike it out so that you're not letting this little tiny dog walk miles, and you allow that circulation to circulate the venom faster. So pick them up to decrease their effort and circulation. Get to a veterinarian immediately and determine what your pet needs based on the type of snake bite they've suffered.
Gotcha. Okay.
Yeah.
Get to the vet immediately. Got it.
That's the
well,
best
we thank
thing.
you for your time and your expertise.
Thanks.
If you missed any of this, maybe you need to send it to a friend or a family member who's got a furry family member. We're going to put it in the Who Wants to Know section of the website.